Hi, and welcome to this special presentation brought to you by Our Lady of Lourdes. I'm your host, Jill Stokeld. Today we'll be discussing a topic that can cause a lot of anxiety and fear for patients: lung nodules. These are often small spots found on the lungs, and we're going to learn about an advanced program at Our Lady of Lourdes designed to find and manage them, catching problems earlier than ever. I'm joined today by an expert on this topic, Dr. Safi Haq, a cardiothoracic surgeon at Our Lady of Lourdes. Dr. Haq, thank you so much for being here with us today.
Thanks for having me.
Okay, to get started, what exactly is a lung nodule and how are they typically found?
So a lung nodule, like you said, is frequently referred to as a spot on the lung. It's basically any kind of irregularity in the tissue of the lung. Basically, they can be solid or they can be kind of hazy on imaging when we see them, when we call them ground glass, meaning that they're not totally solid. But they're usually found on x-rays, CT scans, and the such.
Okay. I understand that most of these are benign or non-cancerous. So what is the main concern when a nodule is found?
So nodules in general, I say they can be infection, they can be inflammation, or they can be related to cancer. So the concern when we find them is to figure out what exactly it is so we can treat it appropriately. Depending on the size, sometimes we watch them, or sometimes they need to be biopsied so we can figure out exactly what it is after looking at it under a microscope.
Makes sense. Okay, so we hear the term incidental finding. What exactly does that mean?
An incidental finding is basically when, with regard to a lung nodule, an incidental finding is when a lung nodule is identified without looking specifically for a lung nodule. So if someone gets in a car wreck and they end up getting a bunch of scans and we find a lung nodule that way, or if they're having belly pain and they get a CT scan of their abdomen and we catch the bottom parts of the lungs and we see something incidentally on their lung, that's called an incidental lung nodule.
Oh, okay. What makes the lung nodule program at Our Lady of Lourdes so unique? I understand that there is a multidisciplinary team that overviews every case that comes in front of them.
Yes, so we're very proud of our new kind of lung nodule program at Lourdes. What makes it unique is that from the very beginning, there's a multidisciplinary approach to it. So the patients are identified either by doctors that get referred lung nodules after they've already been found, or we've got screening software out there that kind of picks up lung nodules. So when these nodules are identified, we have a group of lung doctors, pulmonologists, surgeons, thoracic surgeons, radiation oncologists, and oncologists that all kind of get together. We look at all the findings that we've found and decide how we should triage those patients, who they should go see. So from the very beginning, you're already getting a lot of different perspectives and a lot of different opinions without having even really seen any of those doctors.
Right. It's all done behind the scenes. And again, you're getting I love that, the different eyeballs looking at it and the perspectives. Okay. As a cardiothoracic surgeon, at what point do you get involved? When does it go from watching to needing surgery?
So alluding to kind of what we were talking about earlier with our program, I get involved basically as soon as we see a lung nodule. So we're all involved from, the very early onset of the decision making. So if a lung nodule is being watched, then we just kind of survey them. If it needs a biopsy, we have 3 different ways to biopsy it. Either the radiologist can biopsy it from the outside with a needle. The pulmonologist or myself can biopsy it from the inside of the lung using a bronchoscope, or the patient can have surgery to where we just cut out the nodule and look at it under the microscope at that time. So I could be involved either at the time of diagnosis, if this is something that we want biopsied through surgery with a wedge resection, or for a bronchoscopy. And certainly if the patient has a finding that's significant for cancer and we feel that it's an early stage lung cancer, then I would be involved very soon, because in early stage lung cancers, we find that there's a much higher incidence of cure if surgery is involved early.
Oh, that's great news. So if a patient does need surgery, what does that intervention typically look like?
So it starts with a lot of workup. We have to, cross our T's and dot our I's to make sure that it's safe for the patient to have surgery. Once all those things have been done, then the surgery itself entails a few small incisions on the patient's side going over to their back about this width of my index finger. Through those incisions, we put special long instruments and a camera and use a robotic system to kind of help us get the surgery done. The surgery itself takes anywhere from 2.5 to 4 hours. Our objective is to take out the part of the lung that has the cancer in it and to clean out all the lymph nodes on that side of the chest. The patients are then in the hospital for anywhere from 2 to 5 days, sometimes a little bit longer depending on the situation. And then once they go home, they have a couple weeks of restrictions where they can't lift anything heavier than a gallon of milk before they go back to normal activities. And by and large, if everything goes according to plan, then they're able to go back to normal activities after that. When we get the final results from the surgery, and the pathologists have looked at the specimens and looked at the actual tumor and the lymph nodes, and they tell us the characteristics of the tumor and if there's any spread to the lymph nodes, then we decide if the patient needs any additional treatment like chemotherapy.
That's great. So, and it's shocking to hear that you do all that and they could potentially be home within a few days.
Yeah, that's certainly what we aim for. I feel like, I've been doing this for a short period of time in clinical practice, but lung cancer surgery, I think, has evolved a lot in the last 10, 15, 20 years, whereas before, patients were getting big incisions, needing epidural catheters, needing an ICU stay, and it was just a very daunting experience. Now we're still dealing with the same gravity of problem, the same type of complex operations, but we're able to do so with less pain to the patient, less time in the hospital, and certainly a quicker recovery. That's not to say that there aren't cases where there are more complex issues where we still have to do it the old-fashioned way, but I think our ways of dealing with postoperative pain in thoracic surgery have really evolved a lot. So the hospital stay, I feel, looks different than it may have 20 years ago.
Right. And with this program, obviously, y'all are watching things and catching things much earlier. So for a patient who receives the phone call that there is a nodule or a spot on their lung, what message of hope and advice do you have for them?
I think the biggest message of hope I would have for those patients is that, the amount of anxiety that patient experiences with that finding can only kind of be stratified or quantified by someone experiencing that. So we can all just kind of imagine what they're going through. But we're fortunate to live in an age where we're now able to go after smaller and smaller lesions in the lung to identify an early stage lung cancer and really significantly increase that patient's chances for survival. The bulk of lung cancers in the past and even now are identified in their later stages. So the survival is much lower, and the patients are kind of relegated to chemotherapy and radiation, and, the chances of cure are significantly lower. Now that we're able to identify earlier stage lung cancers and treat them with surgery and any other thing, like chemo that they need, I think we have a much higher chance of, increasing people's survival if they do have a lung cancer. So that'd be my message of hope. My advice would be to not ignore it.
Very good. Well, that certainly is a reassuring message for our viewers out there. Dr. Haq, thank you so much for shedding some light on this topic and the amazing work that this program is doing to protect our community.
Of course, yeah.
On behalf of Our Lady of Lourdes, thank you for joining us. To find out more about the lung nodule program or to find a provider, please visit lourdesrmc.com/lung nodule. I'm Jill Stokeld, and we'll see you next time.